Cholera, it's an infectious condition that affects your gastrointestinal tract. And it's highly infectious in that the bacteria causing this disorder can survive extreme environments. Now, cholera itself is so very common in locations that have low standards of hygiene. And apart from that one, it's also important to take note that cholera is so very common in areas that have poor sanitation. Okay, now on the definition, this is defined as an acute infectious disease caused by Vibrio Cholerae, which is characterized by copious rice watery diarrhea, projectile vomiting, muscle cramps, severe dehydration, and vascular collapse. From this definition, there are important keywords that we might want to focus on. The first one is acute. The term acute is an English word which may indicate that this condition is sudden in nature. Then apart from that, the other term is copious, which is another English word which may indicate plenty, a lot. So holistically, for a definition to be regarded to be a good definition, it should describe or it should outline what is causing such a condition. Then, of course, what could be some of the signs and symptoms that come along with such a condition. And by the way, we understand that this is affecting the GIT or the gastrointestinal system. Now, incubation period for Vibrio Cholerae is basically from few hours to 5 days, ultimately 7 days. So from few hours to 5 days would see an individual, if they are infected with Vibrio Cholerae, they will start presenting with signs and symptoms. Then the transmission for cholera, it's actually fecal oral route and not oral fecal route, but fecal oral route, meaning from feces to someone's mouth. And this can be obtained by ingestion. And someone could ingest contaminated fruits, contaminated vegetables, contaminated fluids. So that's the transmission, fecal oral route. All right. It could be very important again to get a bit more in details in terms of the causative organism. So cholera is caused, of course, like what earlier indicated, by Vibrio Cholerae, but it's important to take note that there are two bowel types, and these are namely one, classical Cholerae Vibrio, and hemolytic aorta Vibrio. So critical information that should not be forgotten. Then it's also important for us to know the characteristics of Vibrio Cholerae. The first characteristic is that this bacteria is comma-shaped. Then apart from that one, it's aerobic, gram-negative, then periods in a dormant state. And apart from that, it is non-spore forming, motile. It can only be denatured at a very high temperature, 55 degrees Celsius, can survive in watery environments for extended periods of time. And on the epidemiology, what we can pick out from the epidemiology is that cholera is a disease of low socioeconomic groups. Why has it been designated as a disease of low socioeconomic groups? Because the group of low socioeconomic standard come with a lot of difficulties. Number one, there will be poor health services, unsafe water supply, inadequate, and unfortunately, at times, absent sewage disposal. Then it's very important to take note that cholera is common in Asia and Africa. And of course, this was alluded to earlier on. The infection spreads from contaminated feces and water. Other potable foods may include milk, foods that are not properly cooked, foods that are not properly covered after being prepared, leftovers, and washed fruits and vegetables. So all these can be sources of the Vibrio Cholerae. On the pathophysiology or the pathogenesis, that after someone has ingested contaminated foods and water, the Vibrio Cholerae, which is the bacteria responsible for cholera, will remain in the gastrointestinal tract. And take note, it does not at any time penetrate into the blood stream. Instead, it will adhere or attach itself to the lining of the small intestines. And this is very important information. Cholera affects the small intestines. It does not affect the large intestines. So it will adhere to the inner lining of the small intestines by the use of fragile adhesions. Then what would happen is that Vibrio Cholerae, which is a bacteria under discussion, will produce toxins, which are enterotoxins. It is these enterotoxins that causes excessive fluid and electrolyte loss. Important information again. Now, what would happen is that sodium chloride absorption would be inhibited or stopped, and this would result in a retention of massive amounts of water. And what would happen is that there will be excessive vomiting, because the vomiting center in the brain is negatively affected. Apart from excessive vomiting, what will be noticed is the diarrhea due to increased peristaltic movements. Immunity to both cholera toxin and bacterial surface antigen follows natural infection. Now, if the patient is not rehydrated within the shortest period of time, 2.5 to 3 hours, the patient's circulatory system may just collapse, and this will result in mortality or death. Now, discussing the signs and symptoms is threefold. The first phase is known as evacuation phase. And this first phase, which is known as evacuation phase, will be noted by mild to acute onset of diarrhea. And take note, this diarrhea usually contains fecal matter, but later becomes watery with flakes of white described as rice watery stew. Then apart from that, during this phase, which is the evacuation phase, a patient may also present with projectile vomiting. Apart from that one, this may be followed by severe dehydration due to the diarrhea and the vomiting that the patient experienced earlier. It's also important to take note that the evacuation phase is followed by a phase known as collapse phase. So under the collapse phase, we'll have muscle cramps due to loss of electrolytes, metabolic acidosis indicated by signs of air hunger with deep, sometimes rapid breathing. This is also important. And apart from that, during the collapse phase, we would have an individual going or developing hypovolemic shock. Hypo is low. Volemic, it has to do with volume and the blood. So this type of shock is as a result of depletion of fluids in the system. And this will be noted by hypotension, tachycardia, a pulse that may be impalpable at the wrist. The skin will be very clammy and cold. Oliguria can be noticed. Then apart from that, if we do not have any serious intervention during the collapse phase, this will ultimately result in renal failure and mortality. The last phase is known as recovery phase. The patient here improves and the signs and symptoms eventually decline. What could be the management for such kind of a patient? Number one, when you are writing during your exams, management, I said, is subdivided into two. We have medical management and we have the nursing management. What could be the aims? Number one, to correct fluid and electrolyte imbalance. Take note, your aims begin with the word to, T-O. Secondly, to eliminate the causative organism. Thirdly, to prevent the spread of infection. Fourthly, to prevent complications due to loss of fluid and electrolytes. In an exam, 3 to 4 aims will be sufficient. How will we diagnose this patient? What is very important, because before even go to laboratory investigations, what will be very important for us is to do what is known as the physical examination and history taking. Firstly, you obtain the history, and the history will actually demonstrate that this patient is coming from an area which has poor sanitation. Physical examination, on physical examination, you will notice the dehydration, which can be seen from sunken eyes, the poor skin tagger, etc. Laboratory investigation, we can do dark field microscopy of the stool. Apart from that, we can also obtain stool ovometers or probably rectal swab for microscopy, culture and sensitivity. Then we can also perform immunofluorescent. Okay, so these are important. How do we treat this patient? It's basically by administration of fluids. Now, fluid therapy, it can also be actually supplemented by administration of ORS, oral rehydration salt. So we need to start with intravenous infusion of fluids such as Linger's lactate or normal saline if we do not have Linger's lactate. And as you are putting up such fluids, ensure that the patient is also drinking ORS orally. This is important. Now, how do we administer these fluids? In severe dehydration, when you have noticed this patient has come your way, you give 30 ml per kg body weight in the first 30 minutes. And this should be rapid intravenously. Then this will be followed by 70 ml per kg body weight in the next 2.5 hours, meaning we are administering this fluid depending on the weight of the patient. Remember, the first 30 minutes, 30 ml per kg body weight. Then the second phase is 70 mL per kg body weight for 2.5 hours or 2 and 30 minutes. Our aim is to restore normal dehydration within 2 to 3 hours. And it's very important for you to continue rehydrating the patient at a slower rate after the resuscitation phase. When the patient can drink orally, you can administer to them oral rehydration salt 5 mL per kg body weight per hour, meaning approximately 250 mL per hour should be taken by this patient. And by the way, as you are doing this, the patient is also having IV line instituted and fluids are flowing or being given. We need to monitor vital signs every after 30 minutes. Now, it's important that if signs of secretory overload are detected, we need to slow down the rate of flow. The patient will be noticed, probably they become so puffy, so try to slow down the rate of the flow of the fluids. Monitoring urine output every hour is very critical because this will indicate to us if the kidneys are functioning very well. So normal is between 30 to 40 mL per hour. We need to maintain the patient on fluid therapy by giving plenty of fluids to compensate for the massive loss of body fluids equally. What drugs do we administer? I should indicate that usually antibiotics given to patients may alter or may be changed per session of an outbreak because they will take a rectal swab and subject that swabbing to MCS, microscopic count and sensitivity, the drug to which this bacteria responds will be the drug of choice for that particular outbreak. So number one, antibiotics that can be administered includes tetracycline, 500 milligrams QID for 14 days, doxycycline, 100 milligrams daily for 14 days, cotrimoxazole, 900 milligrams. This is also known as Septri, 2 times a day, or BD for 14 days for that prolonged period of time. In an exam, you may not require to write all the antibiotics, but probably 2 or so will be appropriate. Ciprofloxacin, 500 milligrams BD for 7 days, erythromycin, 500 milligrams QID for 14 days, that's per day. Now, ensure that you indicate the action, the side effects, and the nursing implication for each and every drug that can be administered to the patient. It's also important that you can add, if possible, painkillers to this treatment, which probably can be a Panadol or paracetamol, 1 gram TDS, or 3 times daily for 3 days on maximum. When you come to the nursing management, it's also important that you start with your aims. Now, nursing management, it's the APROPHENEMA acronym being used. Environment, that's the first thing. What do? We need to put the patient should be nursed on a Cholera cot. This is a bed cot, which has a fenestration. Now, this is a simple bed made with a hole in the middle and of material that can be disinfected easily. And usually they would use tents. The patient should be isolated. That's important to take note because they are highly contagious. The environment or ward where the patient is admitted should be disinfected to prevent the spread of infection. Now, another important subheading that we need to understand and put up, it's the infection prevention. So this subheading usually speaks to what you would do to prevent the spread of this infection. Number one, we have done the isolation. Secondly, individuals that are coming in contact with the patient should observe isolation techniques, such as putting on gowns and masks whenever they enter the room. washing hands before and after attending to the patient. This is important information to the attending health workers. Then apart from that, restriction of visitors is so paramount. The linen should be disinfected and should be labeled infectious after they are being sold. And this is done before sending that linen to the laundry for washing. Then it's also important that we need to administer prescribed medication to ensure that the causative organism, Vibrio Cholerae, is treated. All utensils, plates, spoons, cups, etc., should be disinfected. Position, the patient can attend the position of their choice, which they feel very comfortable. For the patient that will be severely dehydrated and has less energy, this patient may be assisted to assume a position that will just prevent sore formation. Then on the point of rest, we need to promote rest by creating a quiet environment. All the nursing activities should be done collectively so as to reduce disturbances and to promote recovery. And that's actually for ensuring that the patient has enough energy. Then hygiene, we need to educate the patient on simple hygienic measures such as the hand washing after bowel movement. The patient should also be offered bed bath if possible. If they are able to stand, tub bath can be applicable. Now, this is important because it promotes self-esteem and also helps in removing the dirty on the body of the patient. And anyway, this may also prevent halitosis because of the vomiting. Observation, vital signs are so clear. And apart from us ensuring that we observe the vital signs, other signs and symptoms should be noted. For example, dehydration can be noted through dry mucous membrane, sunken eyes, decreased skin tag, and thirsty. Okay, so this is critical. Monitor vital signs every after 30 minutes. That is pulse rate and blood pressure. Now, if signs of secretory overload are detected, slow down the rate of flow, and I earlier indicated that this could be attributed to the puffness or the edema that can be noted from the patient. Okay. Now, fluid retention or nutrition, we continue giving IV fluids. Normal diet should be resumed as soon as possible so that the worn out tissues can be replaced. Then psychological care becomes very important. Explain the disease process to the patient and tell them the reason as to why they have been isolated. This is important because it allays the anxiety. Explain all this information to other significant members of the family. So it's so important, okay? Then medication, administer prescribed drugs. And of course, it's also important that we observe the side effects. Administer again the fluids according to the patient's condition and according to the prescription. Observe intake and output and record them. This is under elimination. Provide a bedpan in the initial stage. As the condition improves, the patient can go to the nearest toilet. Disinfect the stool before disposing. And that's why there are beds which are made out of tent. Underneath, there's a bucket which contains jik so that they can open bowels on the tent, on the bed, and directly it goes into a disinfectant. Prevention and control of cholera. Number one, proper disposal. This is the same preventive measure that can be given to all diarrheal conditions. So number one, proper disposal. Okay, and this is proper disposal of waste, and it could also include fecal waste. Secondly, we also need to ensure that at all times, sterilization or boiling, filtering, and chlorination of water that is being drunk by the population is adhered to. All materials that come in contact with cholera patients should be sterilized. I think that's an additional point to sterilization. Then the other thing that is also important, we need to improve water supply and sanitation. Contact tracing. Contact tracing, it's a procedure by which individuals that are related to the patient are traced down and treated. Personal hygiene, hand washing at all times, this is also very critical. Then festivals such as weddings, chilangamuliro, kitchen parties, birthday parties should be postponed. Why? Because they become super spreaders. Now, change of attitude and behavior in individuals of that particular population, again, that's another critical point that we can bring across as a preventive measure. Adequate treatment of cases, if possible, massive treatment of cases. We need to report these cases whenever we notice even one, okay? One case is equal to an outbreak, so notification should be done. Then on the complication, which is the last component of this presentation, we'll have paralytic areas, muscle weakness, cardiac arrhythmias, renal failure, metabolic acidosis, hypoglycemia, pulmonary edema. And the next lecture we'll discuss is on typhoid fever, and which will be followed by paratyphoid fever. So we end here, and of course, with a call